A very good morning, everyone. I am talking about today the intra-arterial chemotherapy in refractory and advanced retinoblastoma, a game changer. I have no financial interest. So we all know that the systemic chemotherapy is the mainstay for the treatment in the retinoblastoma along with the focal therapy, and it has a very favorable result when it comes to the salvaging of eye of group A and B, C, nearly 100%. However, the systemic chemotherapy in cases of the advanced retinoblastoma of group D and E with diffuse vitreous seeds has shown the very limited results in terms of the eye salvage. However, over the last past decade, the targeted treatment in the form of intra-arterial chemotherapy and intravitreal chemotherapy has completely changed the treatment paradigm for the advanced cases of retinoblastoma and also improved the eye salvage in advanced cases. So many patients, as we know that in our setting, presented with the group and D, and it accounts for nearly around 78% in case of the intraocular group, and inoculation remains the mainstay of treatment. However, the Sales et al. Have shown that the group salvage in the 57% of the eyes with secondary ISC post-systemic chemotherapy in advanced retinoblastoma, in which otherwise the inoculation remains the mainstay of treatment. In India also, the few studies have been done showing the promising result in the management of retinoblastoma using the advanced modalities like the intravitreal chemotherapy and intra-arterial chemotherapy. So the aim of this study is to evaluate the efficacy of secondary intra-arterial chemotherapy as a globe salvage modality in advanced and refractive cases of retinoblastoma. So it is basically the retrospective non-randomized case series of advanced intraocular retinoblastoma that patient refractory to the systemic chemotherapy, and the duration is between all the patients who have underwent the procedure between 2018 to 2021. 13 patients were included in this study. Coming to the methodology, all patients with the unilateral and bilateral group D and E, according to the international classification, who underwent secondary and rescue intra-arterial chemotherapy during the ever mentioned period. All the patients underwent standardized ISC procedure by super-selective ophthalmic artery catheterization, and then chemotherapeutic agents, triple drug therapy were injected except in one. And the tumor status were evaluated after the 4 weeks under anesthesia, and the post-op complication, immediate and final outcome, including the visual outcome and the globe salvage, was documented. So coming to the results, out of 13 patients, 12 patients have received the secondary ISC after being primarily treated with the systemic chemotherapy and focal therapies, and one patient has received the rescue ISC after recurrence of primary intra-arterial chemotherapy, and mean number of intra-arterial cycles was 2. So overall, in our study, the globe salvage rate is 53.84% with mean follow-up of 18 months. The 3 patients underwent inoculation and 3 patients eventually died because of the metastasis. So this table is showing the demographic profile of the patients. The mean age is around 32 months, and male and female were around 6 in the 6. And 7 patient has a bilateral disease, and 6 patient has unilateral disease, and 7 patient has group D disease, and 6 patient has group E disease prior to the procedure. So this is the table showing the treatment details of all the patients. We also had the most common post-adverse effect after procedure is that transient eyelid edema, that is also documented in other study. And the final outcome, the 7 patients has shown the regression, and in 3 patients, patient died to the systemic metastasis, and 3 patients, the patient underwent inoculation. So coming to the discussion, the eye salvage rate in group A and C is very comparable to the dose of systemic chemotherapy, almost 100%. However, for the globe salvage in D and E are variable. In most studies with advanced disease like group D and E, ISC is more effective than the systemic chemotherapy. Sales et al. Also reported the similar in the 5-year data, that 100% in group B and C and 86% in group and D. The overall eye salvage rate in our series is around the 53.84%, and for group D it is around 57.14%, and for group E that is the 50%, so which is comparable to the previous studies. We don't have the much data from India, so only the receipt also has studied this suspect. So in a study from the India, the DC et al. Has reported around 67% and 50% eye salvage at 4-year follow-up for group D and E respectively in the series of the 15 eyes. However, only 2 patients in that series has group E tumor. In our series, however, the 6 patients has a group E tumors and all received secondary ISC. So tumor recurrence can develop in the long term and might affect the globe salvage status. Hence, a longer follow-up will provide the final outcome of intra-arterial chemotherapy is important. As Rishi et al. Also documented that the eye salvage decreased from 93 to 66% at the 4-year follow-up from the first year. So the use of adjunct intravitreal chemotherapy along with intra-arterial chemotherapy can improve the globe salvage. And since primary intra-arterial chemotherapy could not prevent the systemic metastasis, a combined approach of the cost-effective systemic intra-arterial systemic chemotherapy and intra-arterial chemotherapy can be optimal approach for this advanced disease. So the conclusion is that the IAC salvage intra-arterial chemotherapy with triple drug following failure of systemic chemotherapy with other adjunct modalities will be cost-effective and safe option for eye salvage in advanced intraocular retinoblastoma with a globe salvage rate of 53.84%. And it is also an effective approach to improve the treatment compliance and help in addressing the barrier of treatment refusal when enucleation is advised. Thank you.
Thank you very much, Dr. Namita. Very nice presentation. Couple of questions here.
Yeah.
So you used 3 drugs,
Yes,
if I understand. Yeah. What was the rationale of using 3 drugs?
Ma'am, because there's all our the patient who went under the secondary ISC. So there's the tumor size and the burden of the tumor is like more. The Abramson et al. Also has reported with the triple drug therapy, they have a better outcome. And another issue is, ma'am, that is the cost effective because there's a cost effective of a single ISC. And these all patients are the poor patients. So for that, we gone for the triple to maximize that efficacy.
Okay. Go ahead.
So regarding the number of cycles of IAC provided, you had a range from 1 to 3 and your median was 2.
Mean is 2.
So what was the rationale behind or how was it ceased after 1 cycle? A few of the patients just had 1 cycle of IAC.
Yes.
So did they then was it followed up by systemic chemotherapy afterwards? Or
in some patients, we have also given the synergistic systemic chemotherapy also. Because, in between the procedure.
So how was that scheduled? So your IC were 3 weekly apart and then along with that...
It's not like, after 4 weeks, we still had that. We also have given the adjunct treatment in the form of like intravitreal chemo, depending that...
Right, no, I'm talking about the systemic chemotherapy, the patients who
like,
you stop the intra-arterial...
As I said, this is a cost-effective procedure also. Like when we are not getting the ISC scheduled for the patient because of the many things. So in between, we have to keep the child on the chemotherapy.
Okay. So you had planned for the cycles of ISC, however the child could not be given the further cycle. All right. And the 3 children who...
so the 3 children in which the death happened, the 2 is from the group D eyes and 1 is from group B.
What was the interval between the last therapy and
the 2 group D eye patient, the patient did not improve after the ISC. It basically get worsened. And so we advised the enucleation to the patient. So however, the patient was not compliant to the enucleation and patient lost to the follow-up and then it come at the stage 4. In one patient, what happened, it was a completely regressed tumor and after that, COVID lockdown happened and it was the UA was scheduled after 4 weeks, but however the child come after like 2 months and that time it was a very bitterest hemorrhage. Again we have given the next ISC but it was not responding. We did enucleation and after that the adjuvant chemotherapy, but after that 6 months the child presented with the mets.
All right, yeah, okay, thank you.